Good morning, everyone. Aging is a journey filled with wisdom, reflection, and yes, a few extra trips to the doctor's office. By the time we reach 70, many of us are familiar with the routine of checkups, tests, and screenings. After all, we've been told our whole lives, early detection saves lives. And for the most part, that's true. Preventative care has undoubtedly played a role in longer life expectancy and improved outcomes. But here's something that doesn't get talked about nearly enough. Some medical tests and screenings can become more risky than beneficial as we age. That's right. What may be a helpful routine checkup at 50 or 60 could actually lead to complications, anxiety, or even unnecessary treatment at 70 or beyond. This doesn't mean we should ignore our health or avoid seeing doctors. On the contrary, we should stay informed, alert, and proactive. But we also need to recognize that healthcare after 70 should be personalized, not automatic. Just because a test is available doesn't mean it's right for you. In fact, some well-meaning screenings can do more harm than good, especially when they lead to overdiagnosis, overtreatment, or risky procedures. Today, I want to shine a light on this rarely discussed reality. Let's explore 5 common medical checkups that might carry more risk than reward for seniors over 70 and how we can make better informed decisions when it comes to our health in our golden years. Colonoscopy is one of the most well-known and widely recommended cancer screening tests, particularly for detecting colorectal cancer. It has long been praised for its ability to catch early signs of cancer, remove precancerous polyps, and potentially save lives. For adults in their 50s and 60s, routine colonoscopies, typically every 10 years, are often a smart preventative measure. But once a person reaches the age of 70 and beyond, the picture becomes more complicated. The primary concern is this: does the potential benefit of a colonoscopy still outweigh its risks for older adults? Let's start with the basics. A colonoscopy involves inserting a long, flexible tube into the rectum to examine the colon for abnormalities. While this procedure is generally safe, the risk of complications increases with age. For adults over 70, those risks include bleeding, bowel perforation, a tear in the colon wall, dehydration, infection, and adverse reactions to sedation. These complications, while relatively rare, can become much more serious and harder to recover from in older bodies with weaker immune systems or coexisting health conditions. Another factor to consider is life expectancy and individual health status. Colon cancer typically grows slowly. In many cases, it takes years for a polyp to turn into cancer. For someone over 70 who is in excellent health and has a life expectancy of 15+ years, continued screening might still make sense. But for others, especially those with chronic illnesses, frailty, or limited mobility, the risks of colonoscopy may exceed the possible benefits. There's also the question of overdiagnosis and overtreatment. Colonoscopies can detect benign polyps or non-threatening lesions that might never cause harm in a person's lifetime. Yet, once discovered, these findings often lead to follow-up procedures, additional tests, or even surgery, all of which can place stress on an aging body and impact overall quality of life. Another point that's often overlooked is preparation for the test itself, which can be very taxing for seniors. It involves fasting, strong laxatives, and sometimes dehydration, all of which can be hard on elderly individuals, especially those on medications for blood pressure, heart conditions, or diabetes. That said, colonoscopy is not inherently bad for people over 70. What's important is individualized decision-making. If someone has a history of colon cancer in the family, has had abnormal results in the past, or is otherwise healthy and wants to continue screening, the test might still be appropriate. But it should never be a one-size-fits-all recommendation. In fact, many medical guidelines, such as those from the U.S. Preventive Services Task Force, recommend stopping routine colon cancer screening at age 75 unless there are specific reasons to continue. For many older adults, less invasive alternatives like fecal immunochemical tests or stool DNA tests may offer a safer way to monitor colorectal health. In conclusion, colonoscopy is a valuable tool, but after 70, it requires thoughtful discussion with a healthcare provider. The goal is not just to live longer, but to live better, with fewer risks, fewer complications, and more control over our healthcare choices. Prostate cancer is one of the most common cancers among men, and over the past few decades, the PSA, or prostate-specific antigen blood test, has become a standard screening tool. It measures the level of PSA, a protein produced by the prostate gland, in the blood. Higher levels may indicate cancer, but not always, and that's where the concern begins, especially for men over the age of 70. At first glance, regular screening sounds like a smart preventative step. After all, catching cancer early can save lives, right? But the truth about PSA testing is more complicated, particularly for older men. In this age group, the risks of PSA screening often outweigh the benefits. Here's why. As men age, PSA levels can rise naturally, even without cancer. This can lead to false alarms. A slightly elevated PSA might trigger a cascade of anxiety, repeat testing, painful biopsies, or even unnecessary treatments, despite the fact that many prostate cancers are slow-growing and may never cause symptoms during a man's lifetime. This brings us to a major problem with PSA screening: overdiagnosis. Studies show that up to 60% of prostate cancers detected by PSA tests in older men are so slow-growing they would never become life-threatening. Yet once cancer is diagnosed, most men feel compelled to treat it, even when treatment may not be needed. Now, the treatments themselves, such as surgery or radiation, can be far more harmful than the cancer. They come with serious side effects, including urinary incontinence, erectile dysfunction, fatigue, bowel problems, and increased risk of infections or complications during recovery. For a man in his 70s or 80s, these consequences can drastically reduce quality of life and are often irreversible. Then there's the emotional toll. A cancer diagnosis, even of a slow-growing type, often creates long-term stress, fear, and unnecessary medical appointments. It may shift focus from more pressing health issues like heart disease, diabetes, or mobility, conditions that are more likely to impact daily life and longevity. This is why major health organizations, including the U.S. Preventive Services Task Force, recommend against routine PSA screening for men aged 70 and older. They argue that the potential harms, false positives, biopsies, complications, and overtreatment often outweigh any small benefit. But this doesn't mean the PSA test has no place at all. For healthy older men with a strong family history of prostate cancer, or men with symptoms such as difficulty urinating, blood in urine, or pelvic pain, a PSA test may still be appropriate. What matters most is personalized, shared decision-making between the patient and doctor. In summary, PSA testing after 70 should not be automatic. It should be approached with caution, discussion, and a clear understanding of what the test can and cannot tell us. The ultimate goal isn't just to live longer, but to live well, with as little medical intervention, stress, and side effects as possible. For decades, mammograms have been a vital tool in the early detection of breast cancer. Countless lives have been saved by spotting tumors early when they are easiest to treat. But as women enter their 70s, the question becomes more complex. Should mammograms still be done routinely after age 70, or can they cause more harm than good? Let's start with what a mammogram is: a low-dose X-ray of the breast that can detect cancerous lumps or abnormal tissue long before they can be felt. It's a powerful screening method, but like all medical tests, it isn't perfect. And for women over 70, the effectiveness and safety of mammography starts to shift. One of the main concerns with routine mammograms in older women is overdiagnosis. Not all breast cancers are aggressive. In fact, many grow so slowly that they would never pose a threat during a woman's lifetime. But mammograms can detect these tiny, slow-growing tumors, which often leads to overtreatment. Once a lump is found, it usually triggers a whirlwind of follow-up procedures: biopsies, additional imaging, surgery, radiation, and sometimes even chemotherapy. For older women, these interventions can come with serious side effects, including fatigue, infection risk, impaired healing, and reduced quality of life. All this may happen in response to a cancer that may never have grown large enough to cause harm. There is also the risk of false positives. Studies show that older women are still at risk of receiving a mammogram result that appears suspicious but turns out to be non-cancerous. This can lead to unnecessary emotional distress, repeated testing, and potentially painful procedures, all without any real health benefit. Another critical consideration is life expectancy and overall health. Breast cancer often develops slowly. If a woman is in her 70s or 80s and has other significant health issues like heart disease, diabetes, or limited mobility, it's possible that she may never experience symptoms from a small, slow-growing cancer. In such cases, the screening might do more harm than good. That said, mammograms after 70 aren't automatically bad. For older women in excellent health with at least 10 years of life expectancy, and especially those with a strong family history or genetic predisposition, continued screening may still offer value, but it should never be treated as a one-size-fits-all recommendation.
Experts, including those at the U.S. Preventive Services Task Force, USPSTF, suggest that mammograms after age 74 should be based on individual needs, not routine. Even before 74, some experts advise women to evaluate the risks and benefits carefully as they age. The key takeaway is this: informed, personalized decision-making is essential. Women over 70 should have open conversations with their doctors, considering their medical history, personal values, and quality of life goals. In conclusion, mammograms remain a powerful tool, but after 70, they should be used thoughtfully, not automatically. The goal is not just to detect disease, but to ensure that medical care truly helps us live better, longer, and more comfortably. In today's technology-driven world, full-body scans are often advertised as the ultimate preventative measure, an all-in-one test that can detect cancer, aneurysms, heart disease, and other hidden conditions before symptoms ever arise. It sounds like peace of mind in a single scan. But for adults over 70, full-body scans may offer more false promises than real benefits and may actually introduce new risks. So, what exactly is a full-body scan? It's typically a CT or MRI scan that images the entire body from head to toe, regardless of symptoms or medical history. These scans are usually not covered by insurance unless medically necessary, and they're often marketed directly to consumers as early detection tools for diseases like cancer. While that might sound appealing, especially for health-conscious seniors, the reality is more complicated. For one, there's no scientific evidence that full-body scans improve longevity or health outcomes in healthy adults, particularly those over 70. In fact, many health authorities, including the American College of Radiology, strongly discourage routine full-body scans for asymptomatic people. One major problem is the exposure to radiation, especially with CT scans. A full-body CT exposes a person to a high dose of ionizing radiation, hundreds of times more than a regular X-ray. For older adults who have already had years of medical imaging, this additional radiation can contribute to an increased lifetime risk of cancer. Even if the risk is small, it becomes more concerning with age and cumulative exposure. Another big concern is the risk of incidental findings, often called incidentalomas. These are unexpected abnormalities that show up during a scan, such as small cysts, nodules, or benign growths that are usually harmless. But once they're discovered, they often lead to more scans, biopsies, and sometimes invasive surgeries. In seniors, especially those with other health conditions, these follow-up procedures can bring significant risks: bleeding, infection, complications from anesthesia, and longer recovery times. Emotionally, incidental findings can cause anxiety and stress, as people may be told they have something suspicious without clear answers. This uncertainty often leads to a cascade of tests and appointments, a process known as the diagnostic spiral. For many seniors, this does not lead to improved health, but rather increased medicalization of their remaining years. Moreover, full-body scans often detect age-related changes that are completely normal, like mild degenerative disc disease or small lung nodules, that don't need treatment. But without the right context, these findings can trigger unnecessary concern and treatment. In short, more scanning doesn't always equal better care. For people over 70, the goal of healthcare should increasingly focus on quality of life, not the endless pursuit of potential problems that may never cause harm. The bottom line, full body scans after 70 are rarely justified unless you have specific symptoms or a high-risk medical history. Seniors should be cautious about commercial scan offers and consult a trusted healthcare provider before undergoing unnecessary testing. In conclusion, when it comes to full body scans in older age, less is often more. More comfort, more peace of mind, and more freedom from unnecessary medical intervention. As we age, our bones naturally become thinner and more fragile. This is especially true for women after menopause and for men later in life. To detect and manage this loss, many healthcare providers recommend bone density tests, commonly known as DEXA scans, dual energy X-ray absorptiometry. These scans measure how much calcium and other minerals are in your bones and help diagnose osteopenia, or low bone mass, or osteoporosis, more severe bone thinning. For seniors over 70, the test can be valuable, but it's not always necessary, and in some cases it may even lead to unnecessary treatment or harm. Let's break it down. DEXA scans are non-invasive and involve minimal radiation. For older adults who have never been tested before, especially women over 65 or men over 70, the scan can be a useful baseline. If someone has already suffered a fracture, is underweight, takes medications that weaken bones like steroids, or has a family history of osteoporosis, this test can guide important decisions.
However, the problem lies in routine or repeated testing, and in what happens after the diagnosis. Many older adults are diagnosed with mild osteopenia, a condition that may never lead to a fracture or affect their quality of life, yet this pre-osteoporosis label often results in medications, repeat scans, and a fear of falling or moving freely, all of which can reduce a person's sense of independence and well-being. Medications used to treat bone loss, such as bisphosphonates, Fosamax or Boniva, or newer drugs like denosumab, can help prevent fractures in high-risk individuals, but they also carry risks, especially when used long-term in older adults. These risks include jawbone damage, osteonecrosis, unusual femur fractures, gastrointestinal issues, and in rare cases, serious infections. Additionally, DEXA scan results may not always accurately reflect fracture risk. Some people with low scores never break a bone, while others with moderate scores do. Bone strength is just one piece of the puzzle. Balance, muscle strength, vision, medications, and overall mobility also play critical roles in determining a person's real fall and fracture risk. Because of these concerns, many health experts recommend a more individualized approach to bone health after 70. Rather than relying only on DEXA scan results, doctors may use a tool like FRAX, Fracture Risk Assessment Tool, to assess a person's actual risk of breaking a bone in the next 10 years. This includes factors like age, gender, smoking status, and previous fractures. In many cases, lifestyle measures such as resistance exercise, vitamin D, calcium-rich foods, fall prevention strategies, and maintaining a healthy weight may offer as much or more benefit than medication for seniors with mild to moderate bone loss. In conclusion, bone density testing after 70 should be thoughtful and personalized. For some, it's a helpful guide. For others, it may lead to overdiagnosis and side effects that outweigh any benefits. The goal isn't just stronger bones, it's a stronger, safer, and more confident life. As we age, it's natural to want to stay proactive about our health. After all, we've spent a lifetime being told that regular checkups, tests, and screenings are the key to catching problems early and staying ahead of disease. And in many cases, that's absolutely true, but only to a point. After age 70, the approach to medical testing needs to change, not because our health matters less, but because our body's risks and priorities shift. The truth is, more medical testing doesn't always lead to better outcomes. In fact,
as we've seen across these 5 common checkups: colonoscopy, PSA testing, mammograms, full body scans, and bone density tests. Routine screenings can sometimes do more harm than good. Why? Because aging brings complexity. Our bodies become more sensitive to procedures, sedation, radiation, and medications. A test that once offered clear benefits in our 50s or 60s may now introduce unnecessary risks, lead to overdiagnosis, or set off a chain of treatments and interventions that may diminish quality of life rather than improve it. Let's be clear, this isn't about avoiding healthcare. It's about choosing smarter healthcare. It's about understanding the difference between testing that helps and testing that hurts. For example, a colonoscopy might detect a slow-growing polyp, but also carries risk of bleeding or bowel injury in an 80-year-old. A PSA test might pick up a non-aggressive prostate cancer that never would have caused harm, yet trigger surgery with serious side effects. A mammogram might find a tiny tumor in a woman who may never live long enough for it to progress, but still face the stress and hardship of cancer treatment. A full body scan might identify harmless age-related changes, setting off a wave of worry and follow-up tests. A bone density scan might lead to a label of osteopenia and prescriptions for drugs that cause painful side effects without a clear benefit. Instead of automatic testing, we need shared decision-making. Seniors deserve personalized care that considers their full health picture, not just their age or test results. Conversations with doctors should include questions like, what are the potential harms of this test? Will the result actually change how I'm treated? Is there a less invasive or safer option? How does this fit with my personal goals for health, comfort, and independence? And most importantly, do I really need this test? Aging well means focusing on what matters most: mobility, mental clarity, freedom from pain, emotional well-being, and meaningful time with loved ones. Medical care should support those goals, not distract or harm us in pursuit of conditions we may never feel. In conclusion, life after 70 isn't about doing less, it's about doing what's right. It's time to rethink the idea that more testing always equals better care. With the right information, open communication, and thoughtful decisions, we can ensure that our later years are healthier, safer, and more fulfilling on our own terms. Thank you.